Hello everyone, my name is Sarah Janik. Thank you for joining me here today. I have prepared for you a PowerPoint on the effect of mindfulness therapy on nursing burnout. Thank you once again for coming. So we're going to go continue on to the next few slides where we're going to discuss what exactly this is all about. What are we going to do about mindfulness in the nursing practice? Why do we need it? We're going to look over best practice, review the research on what we should do about it and how the best way to do it would be. Why is it important? Identifying that need for practice, reviewing recommendations by researchers, and let's just continue onward. So let's begin with the identification of this problem, nursing burnout, and we'll discuss more what that entails on the next few slides. Nurses are experiencing this on a large scale. So we have a third of nurses reporting experiencing burnout. We have 18% of nurses in a study done on 1,100. So to put that in perspective, about 200 nurses out of the 1,100 do report having depression or depressive symptoms. 9% of the general population actually reports having depression or having depressive symptoms. So nurses are at higher risk, double the risk for developing depression when you compare those two statistics side by side. 10 and 26%, we're including healthcare providers, not only nurses, do consider leaving their position because of moral distress, also related to nursing burnout. Signs and symptoms of burnout. I'm sure we're all familiar with at least a few of these as critical care nurses. Fatigue, depression, irritability, emotional exhaustion, depersonalization. You don't know who you are as a person anymore. You're really just focused on the task at hand, and there are multiple tasks at hand. Diminished personal achievement, where you may feel like you're not succeeding in the way you desire at the end of any shift, or even just in general in your career, because there is so much expectation on the nursing field and profession that you maybe feel like you're not good enough, and when there's so much demand required of you, you're not gonna feel like you're doing the best you can. You're really just keeping up. You might feel that way. So those are a few signs and symptoms of burnout. And risk factors, what causes nursing burnout? So we can all agree understaffing is a huge issue because that ties into patient workloads. We get more patients when there's less staffing available to us. Ineffective leadership, where we may feel like we're not supported by our superiors. We feel like no one's doing anything to help us down here on the floor. We may have an increased patient workload, like I said, tied into understaffing. Lack of resources, at least in one area or another. You probably go to get something a million times for certain patients and you realize, oh, we're out of it. Or, oh, we don't have, the bladder scanner and we need this to direct our care for this patient. Just things like that put you behind and creates more stress on you. Lack of control over the work environment, you feeling powerless and helpless in your role as a nurse. You're on the floor, you're already so busy, you may feel like there's nothing you can do about it. You don't have the leadership taking over and doing what they need to do, and maybe because of lack of resources, staffing, it all ties into the same thing. Insufficient rewards, where you may be working your butt off and you feel like you're not getting the reward that you deserve. You're not feeling like you're getting acknowledgement, any credit, nothing. So that's gonna eat away at you a bit, and it's gonna result in nursing burnout in the end. So we have the importance of reducing nursing burnout. This is what we're gonna focus on to help resolve this issue entirely. We're gonna improve patient care and safety. That's always our number one goal as nurses. Reduce patient errors or even nursing errors, as in medication errors. Retention of staff. Staff are leaving left and right. The grass is always greener on the other side, so we may lose nurses, staff, in any department from our facility to a whole entirely different facility, and then there's that vicious cycle where we're losing and then getting new nurses we have to train. Improve nurse health. Our well-being is at stake when we're on the floor pushing ourselves as hard as we do. Nursing burnout does eat away at us physically, mentally, emotionally. So we would like to preferably work in a more positive work environment where we're encouraged and supported and we have all the resources that we need just to kind of address the risk factors for nursing burnout. This is the importance of reducing it overall. This is what we need to do. So the research question presented to you is, in the critical care nurse population, P stands for population, how does practicing mindfulness as the intervention, I, compared to not practicing mindfulness, C is the comparison, decrease nursing burnout, which is our outcome, hopefully, within 30 days, just any given time period that we're testing. So the goal is to overall decrease burnout, and the assessment is to look at the effect of mindfulness. So we're gonna go on to a few studies. So my research in the literature review that I found from databases such as CINAHL, EBSCO, and then OVID, these are databases for research. EBSCO is a provider, a database provider for the best available evidence on any given topic that you're researching. OVID is more of a medical research platform. These are all databases that I use to help find the research I'm going to review with you today. So I use the keywords in my search: mindfulness, burnout, and critical care. These are three things that I'm focused on in my research. The limiters, or the filters, as you may know them as when you're doing research, I included a 5-year period, including only academic journals, full text. I don't want just abstracts, peer-reviewed. Let's see, nursing journal subset, because we're nurses, we focus more on the nursing aspects of healthcare. And then the English language, of course. I don't speak a second language, so we're gonna stick with that. Self-care strategies to combat burnout among pediatric critical care nurses and physicians. So this is an article that I found. It's a qualitative descriptive study. It's a lot of big words up here. Basically what that means is it was a study focused on the perspectives of the subjects that were used. Like, they were included nurses, critical care nurses, and physicians in the pediatric critical care unit. So basically they got their feedback on what they need in their unit or what they experience in their unit. These are some interventions that they actually used, and the statistics here report how they felt they helped. So we have about 90% finding the importance of meaning in work, 75% needing to connect with an energy source, whether that be another coworker or something positive in your own life that you might want to use and hold on to throughout your shift. 70% the importance of nurturing interpersonal connections. That's something you want to bond with your coworkers, help each other out, feel like you have that support at least. 60% reported importance of developing an attitude of positivity. So just general positivity, having a good attitude, having positive goals for yourself, that should also help in that stressful environment. 55%, both of the last ones on the bottom, emotional hygiene, and also recognizing one's uniqueness. You are unique, you are a person, you are a nurse as well, but you can tie those things into your practice. Okay. Alrighty, so let's go back to emotional hygiene discussed on the last slide. You need to know that emotional hygiene means a lot. I know that was just one statistic, but certain practices associated with emotional hygiene do tie into mindfulness. It is a practice of mindfulness, and that includes meditation, relaxation, breathing, quiet time, going to another room and just sitting and not thinking or being disturbed by anything. Compartmentalizing your work and personal life. Separate those things. Don't think because you're bad in one area, you're bad in another. A lot of people bring in their personal life to work, and you want to remember to draw a line between those things. So the next article, the effectiveness of mindfulness-based cognitive therapy on the distress tolerance of nurses and job burnout. This was another type of study. 30 nurses were involved. So they underwent basically 8 training sessions of mindfulness-based cognitive therapy, basically incorporating meditation, physical assessment of themselves, mind and body, meditation, yoga, everything you could think of associated with mindfulness-based practices. So half of those nurses went through the training, the other half did not. What they found was the intervention group, the 15 nurses that underwent the training, were positively affected. So nurses did report an improvement in their distress levels, at least their tolerance, because you're building a tolerance. You're always going to have these things. Okay. So why is this important? Let's reflect on our patient care, where we always focus on the patient level of care and their safety. We want to improve our patient satisfaction. Nursing, we obviously want to decrease our work stress. It's very easy to implement mindfulness-based practices in your own life. You can start at home, you can start with a coworker, a friend, anyone you want, and just continue to do a few minutes every day just to kind of build that tolerance to stress. Increase work satisfaction. You'll find that will come to you because you're able to cope with so many things being thrown at you. And then the reduction of errors. When you practice mindfulness, you are increasing your focus on any 1, 2, 3, 4, 5 things because you know how to remain calm and how to clarify your thoughts in that moment because you're practicing that mindfulness. So there are some official recommendations based on this researcher, Miss Liza Rondo. She says to reflect on events that evoke feelings of moral distress. You want to go back on those times where you felt the most in distress or stressed out. Even if it just happened, you want to stop right then and there and focus on how you feel about it. Because if you really try to pinpoint why you feel that way, maybe you can just fix that. Seek support from your colleagues. You want to make sure that you are talking it out with other nurses that you work with. Maybe they're experiencing the same things, thought sharing, things like that. Advocate for your own rights because you're the best person to look out for yourself. If you don't have a very good leader, you don't have anyone really looking out for you. And other people, they might not be focused on what you're doing. So you want to advocate for your own rights and always remember to protect yourself from making any errors with patients, meds, anything like that. Training and developmental programs or workshops to develop moral resilience. Moral resilience is something that you can use to combat moral distress, aka nursing burnout. So any programs or workshops offered in your area, or maybe you know somebody who is into yoga, meditation, maybe you can start picking up that practice and just start training in that, doing something on the side to help you with your work. Discover a connection with the work that is being done. Once again, find an intent, find a purpose in anything that you're doing. Even if you're stressed, just focus on one thing, know that you want to do this one thing and that you're going to carry it out. Discover or educate nurses on how to develop a work-life balance. You helping others is also helping yourself. You know, you feel like you have a purpose in that way, and it's reiterating what you know over and over again to yourself when you're teaching others. Practice emotional hygiene. Once again, meditation, yoga, deep breathing, things like that. Just start practicing little by little. Last, we're going to talk about reducing overstimulation. Once again, meditation and deep breathing exercises. Overstimulation causes a lot of undue stress on ourselves, so we want to focus on how to basically address that. Okay, these are my references. So that's pretty much it. We discussed a few articles on mindfulness-based therapy and their results in a few nursing populations. So thank you, critical care nurses. We're going to complete an exam after this as well, and we'll hopefully get some good feedback. Right? Any questions? Okay, thank you very much.